So cardiovascular disease plays a big role in terms of helping to decide on which therapy is best for a particular patient. It's one of really the key comorbidities that we look at as we decide what to recommend for our patients. This was particularly true when all we had for BTK inhibitors was ibrutinib, where we did see some significant risks, including ventricular dysrhythmias and high rates of hypertension and atrial fibrillation. I would say now that we have more selective BTK inhibitors approved, like acalabrutinib and zanubrutinib, these drugs can safely be used in patients who have cardiovascular disease. However, there are a lot of patients where we're on the fence about what therapy to use, and if a patient has significant cardiac comorbidities and they're otherwise a candidate for a venetoclax-based regimen like venetoclax with obinutuzumab, it's nice to be able to avoid a BTK inhibitor and use a regimen that has no significant cardiovascular toxicities. So that's why I do think it is still relevant, but that being said, we can use the newer BTK inhibitors safely for most patients with cardiovascular disorders. We just need to monitor them closely and counsel them about those risks.